The cautionary tale of cracking your neck, choking on plain old water, even holding in a sneeze. What? Today we're talking about everyday habits and accidents that look harmless on the outside, but can be terrifying and even deadly from a medical standpoint. All right, let's dive right in. Number 1, cracking your neck. That satisfying pop after a long day of staring at your phone feels amazing until it's potentially deadly. Twist too hard or put pressure in the wrong spot and you can tear one of the arteries in your neck. That tear can create a clot that shoots straight into your brain and causes a stroke. It's called a vertebral artery dissection, and while rare, it is not rare enough. It accounts for up to a quarter of strokes in young adults, and the scary part is how ordinary it looks. 1 second you're cracking your neck, and the next second you're dizzy, slurring your words, and maybe even collapsing. Chiropractors themselves too have to be very careful with neck manipulations for this exact reason. The good news is, if you catch it early, treatment is usually blood thinners to keep the clot from traveling, or in some cases, emergent surgery. Number 2, choking on water. Everyone's had that moment where water goes down the wrong pipe, right? You cough, your friends laugh, and usually that's the end of it. But the truth is, when liquid slips past the airway's defenses and makes it into your lungs, the story doesn't always stop there and could possibly take a tragic turn. That stray sip can carry mouth bacteria into the lungs, setting the stage for aspiration pneumonia, a type of lung infection that can spiral into fever, chest pain, and in severe cases, hospitalization. Left untreated, it can even be fatal. If oxygen is cut off, the countdown is brutal. Brain cells start dying in about 4 minutes, and permanent damage or death can follow within 10. Number 3, standing up too fast. Ever stood up too fast and felt like the floor just disappeared? That's orthostatic hypotension, a condition where the blood pressure suddenly drops, leaving your brain starving for oxygen. Usually it's a quick head rush, maybe a little black vignette, but sometimes your body cannot recover fast enough. That's when you faint. You fall, and if you hit your head on the way down, it could be game over. Treatment depends on the cause. Sometimes it's as simple as standing up slower, drinking more fluids, or adding a little salt to your diet so your blood volume stays higher. If dehydration or anemia is the culprit, IV fluids or treatment for the underlying issue can stabilize things quickly. So while most people laugh off the woozy feeling, it's your body sending you a very clear message: don't ignore me. Number 4, sleep apnea. You think sleep is safe, a time for your body to heal and relax, but for people with sleep apnea, every night can be a battle and one step closer to potentially kicking the bucket. You see, the airway closes off, oxygen levels plummet, and the brain jolts you awake in a panic. This can happen dozens, even hundreds of times each night without you even knowing it. From the ER and ICU perspective, untreated sleep apnea isn't just about feeling tired. It doubles your risk of heart attack and stroke, raises your chance of sudden cardiac death, and strains your entire cardiovascular system. Treatment ranges from lifestyle changes like losing weight or avoiding alcohol before bed to things like CPAP machines that keep the airway open with a steady stream of air. Sleep isn't supposed to leave you feeling like you ran a marathon. If it does, definitely time to get it checked out. If you're someone who just wants a little extra support at night, I actually helped formulate a supplement called Do Not Disturb to help support natural sleep rhythms without grogginess the next day. If you're looking for better sleep, check out Do Not Disturb at lifehappens.com or on Amazon. Number 5, caffeine overload. 2 cups of coffee, an energy drink, and maybe a soda sounds like a normal Monday. But add that up and you're easily over the 500 milligrams of caffeine mark, well past the recommended daily amount. In the ER, I've treated teenagers and college students who come in pale, sweating, and shaking, their hearts pounding like they just sprinted a mile, except they've only been sitting at a desk. Push the caffeine dose higher than that and the side effects only escalate to danger territory. Vomiting, seizures, dangerous heart rhythms, and in rare cases, sudden cardiac arrest. That legal stimulant in your coffee cup or favorite energy drink is powerful enough to kill you, so you need to be aware. Treatment depends on severity. Mild cases can be managed with fluids, monitoring, and time while the body metabolizes the caffeine. But in severe overdoses, we sometimes have to use activated charcoal to absorb what's left in the stomach, or even dialysis to pull the drug out of the bloodstream. Number 6, holding in a sneeze. It sounds like an old wives' tale, but holding in a sneeze can actually rupture things inside your head. Sneezing builds up air pressure in your sinuses. When you hold it back, that pressure has to go somewhere. Rare but real case reports have shown burst eardrums, ruptured blood vessels in the eyes, and even brain aneurysm ruptures from people stifling sneezes. Most people get away with it, but sometimes the unlucky ones don't. Imagine stifling a sneeze and ending up with sudden hearing loss or blood leaking into your brain. It sounds extreme, but those cases do exist. If your sneeze is less of a blessing and damage does occur, treatment can range from ear drops and rest for a ruptured eardrum and emergent neurosurgery if an aneurysm bursts. It's a wide range of risk, all from holding back something your body was designed to let out. So next time you feel a sneeze come on, don't hold it in, grab a tissue, not your face. Number 7, ignoring infections. A bug bite, a scraped knee, a UTI, even a pimple. Small things, right? Not always. Infections can spread shockingly fast. What looks like a little redness can turn into cellulitis, an abscess, or worst of all, sepsis, when bacteria hit the bloodstream and your immune system goes nuclear. Blood pressure tanks, organs start shutting down, and without fast intervention, you have a date with the Grim Reaper. In the ER, sepsis is one of the deadliest emergencies I see. 1 in 3 patients hospitalized with sepsis doesn't survive. It often starts with something people ignored. Then, hours later, there are multiple IV drips fighting for their life in the ICU. Treatment is aggressive, but the real key is catching it early. If an injury of any kind gets redder, hotter, or even more painful over a few days, please don't brush it off. That tiny cut could be the opening move in a life-threatening infection. Number 8, swallowing pills without water. Plenty of people dry swallow pills. Heck, I've even been guilty of it in a busy moment. But when a pill lodges in the esophagus, it can burn a hole straight through the lining. Certain antibiotics, potassium supplements, and painkillers are notorious for causing ulcers, bleeding, and long-term scarring when they stick. And that's the best case. Worst case, the pill blocks the airway and you choke to near death. I've personally had to remove tablets with a scope that were literally stuck in someone's throat, dissolving and burning the tissue around them. So treatment can involve endoscopy to remove a lodged pill, acid-suppressing medications to help heal damage, or in severe cases, surgery to repair internal strictures. Something that feels so harmless, such as taking a pill, can end up being a hospital stay. Always wash pills down with a full glass of plain water. It's simple, effective, and it won't mess with your medication. Number 9, popping a pimple in the triangle of death. Raise your hand if you've been guilty of popping a zit. We all have. But I'm sorry to report, if it's in the wrong spot, it can be deadly. There's a reason the area from the corners of your mouth up to the bridge of your nose is nicknamed the triangle of death. Because, well, the veins in this zone connect directly to the cavernous sinus, a space at the base of your brain. And if you squeeze a pimple here, bacteria can get forced deeper into the skin and hitch a ride straight towards the brain. Infections that start as little red bumps can progress into cellulitis, abscesses, meningitis, or even cavernous sinus thrombosis, a dangerous clot inside the skull that can cause vision loss, seizures, or death. Number 10, ignoring chest pain as indigestion. Chest pain at night, many people assume it's just heartburn, take an antacid, and roll over. But sometimes it's not acid reflux, it's a heart attack. And every minute that artery stays blocked, more heart muscle dies permanently. Women in particular are at risk of brushing off the symptoms because sometimes their symptoms aren't what medical professionals call classically textbook. For instance, instead of crushing chest pain, they may feel fatigue, nausea, or even jaw pain. I've treated patients who swore it was just bad food until their EKG proved otherwise. Treatment in the ER is time critical. Clot busting drugs, stents to open the artery, and powerful medications to prevent another devastating attack. So yeah, sneezing, sleeping, popping zits can all become potential moments you never realized you were brushing against death. Are there other times you almost died that I missed? Let me know in the comments below and maybe I'll make a part 2. And if you found this video interesting, do me a favor, binge watch this entire playlist right here. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.